There's probably never been a medical intervention that has improved the health outcomes of a population more than hormone replacement therapy in postmenopausal women. Tragically, 80% of doctors today roughly still believe that it causes breast cancer and refuse to prescribe it. So 50 million women in the last 20 years have been denied this incredible health benefit.
So you start off chapter 4 with probably one of my favorite lines in the book. Quote, "Whenever I'm in South Florida, I feel great. I always leave feeling stronger and healthier," end quote. I agree. That's why we moved here over 2 years ago. But this chapter and this book is not about the wonders of South Florida. Although maybe, there's a little bit we could talk about that there. It's about cholesterol, more specifically, the truth about cholesterol and what we've gotten so wrong there.
Well, my uncle who lives in South Florida and loves it, and he's 92. He eats eggs every morning, and he has most of his life. But during a 30-plus year window, his doctor scared the crap out of him to tell him that the fat and cholesterol in eggs was bad for his health. Turns out that's total misinformation. There was a dogma for 60 years that natural fat was bad for you, and so we saw the food industry move to egg whites only and low-fat yogurt and low-fat everything. Turns out the worst thing you can do to milk is take out the natural fat and add sugar, which is exactly what we have in school lunch programs. Cholesterol, people look for low cholesterol foods. Cholesterol that you consume is not even absorbed by your body. That's one of the great ironies. 90+% of the cholesterol that we eat goes right through our system because it's esterified, which means it's bound to a bulky side molecule and it's just not absorbed. 99% of your cholesterol is made by your body and it's mostly genetic. So the idea that cholesterol and fat are different things, but the idea that you need to avoid cholesterol in your diet is something that's not supported by science.
And can you give a little bit of the history? So I'll segue. The title of the book is Blind Spots. I'll hold it up. When medicine gets it wrong. And so can you provide a little bit of the history of how we got this so wrong on cholesterol and talk about maybe a brief history of Ancel Keys and what happened?
Yeah, the medical dogma of fat being bad for you, that fat and cholesterol cause heart disease, really came from one guy in the 1960s named Dr. Ancel Keys from the University of Minnesota. And he was a slick politician, and he convinced the entire medical establishment of this idea with no scientific support. He had one shoddy study, which ended up being sort of debunked and found to be entirely inaccurate. After his idea in the 1960s, the medical community did 3 major studies to try to prove the fat hypothesis correct, that eating natural fat caused heart disease. None of those 3 studies found an association. And one of them was the largest study ever done in the history of medicine. So it's dogma. And of course, people should not eat portions out of control. They shouldn't eat unhealthy fats. They should generally avoid processed foods and fats with processed foods. But natural fats found in whole foods do not cause heart disease from any of the research that has been done. As a matter of fact, in the book, I interviewed one of the authors of the food pyramid put out by the government and asked her, is there a single study to show that fat causes heart disease? And she said, well, no, but do you mean to tell me everybody is wrong, the American Heart Association and the Surgeon General and everyone? And the purpose of science is to challenge deeply held assumptions. That is probably one of the biggest ones of the modern era, and it still lingers today as a dogma.
So on that note, I don't want to confuse people. We've had Peter Attia on the show, who's a colleague and good friend of yours, and his call to action is get tested for ApoB and Lp(a), which you reference in the book. If you're concerned about heart disease, go to those 2. What does cause heart disease, in your opinion, then, if it's not fat?
The new recognition is that it's general body inflammation. Turns out general body inflammation drives a lot of health status. And when we talk about health in 100 years, we're probably going to talk about how inflamed your body is. Right now, we don't have a great test for it. We have one test called highly selective C-reactive protein, a test that I get when I get my blood tests. But When the body is inflamed, it affects every part of the body. And one of those parts is the coronary artery wall, the blood vessel in the wall of the heart. And when that gets inflamed or enlarged, it enables those dangerous lipoproteins, the small ones, to settle in there and form a plaque. So it's really requires a couple different things. You having these high dangerous lipoproteins in your circulation, and then having the inflammation that allows it to set in. And what drives inflammation is refined carbohydrates, certain types of foods. There's a new thought that seed oils can be driving some body inflammation. Linoleic acid, the highly processed and denatured oils that denature at high temperatures. And you can look when you cook for the oils that are stable at high temperatures and those that are not stable. The ones that are not stable, of course, are the cheap ones, the vegetable oils and the canola oils. And people say that may be driving general body inflammation as well, along with microplastics, which we're learning have some estrogen binding properties. People take in a lot of microplastics, probably not good for your microbiome. And the estrogen binding properties may explain why puberty age is going down each year a little bit. So these are environmental exposures that may be associated with general body inflammation. And it's important for people to know this, Jason, because you can uh, reduce your general body inflammation. I actually can sense when my body's inflamed, but there are low inflammatory foods. And having a healthy microbiome enables you to sort of keep that balance between pro inflammatory bacteria in your gut and more non inflammatory bacteria in your gut.
A lot to unpack there. I'll just go straight to the hot button topic: seed oils. Seed oils tied to heart disease. Is that what I'm hearing?
So we don't have good evidence because this has been more recently looked at, and we don't have great studies. Of course, the NIH is not funding good studies on seed oils, but when you talk to people who really understand nutritional biochemistry, they're suggesting that there may be a correlation there. And it doesn't seem natural, Jason, that people are consuming a fifth of their calories in their diet from linoleic acid and breakdown products of seed oils that don't occur in nature. If you take one of the barcoded foods in America that we buy off the shelf with 50 ingredients, chances are you're going to see linoleic acid and some derivatives of these seed oils, the cheap seed oils. And it seems a little suspect that these are substances that do not naturally occur in the environment or the food system, but they comprise up to a fifth of the calories in today's diet. So we'll see what future research shows, but many of us are concerned about the role of cheap seed oils.
Well, when you say a fifth of calories consumed, I think of it's the dose. If you're having, 1% of your calories in seed oil is probably not an issue. But the reality is it's probably not happening for most Americans, although our listeners, probably good there.
I think, I like to cook with coconut oil, avocado oil, certain oils that are stable at high temperatures. The seed oils are thought to do two things. One, increase your body inflammation. And two, they may have a direct impact on the microbiome. Those are things we're going to wait to see what research shows more about.
It's just to me the fact that you even mentioned this, even in the context of the science isn't necessarily there yet, but you're a pretty heralded physician. You're you're not an influencer on social media trying to scare people. You are highly credentialed. You're a professor at Johns Hopkins. Like you are very well respected, to say the least.
Look, I think the seed oil hypothesis is very interesting. It's a relatively recent description. There may be something there. It certainly makes sense epidemiologically. If you look at the massive rise of insulin resistance, type 2 diabetes, and the alteration of the microbiome, it's been over the last 50 years or so when we've seen the ultra processed foods, the introduction of the cheap seed oils, and the demonization of natural fats, moving the diet to refined carbohydrates. We've also seen the overuse of antibiotics, which alter the microbiome, that is, the balance of bacteria in the gut, and C-sections too. Now, both C-sections and antibiotics save lives, but they're also overused and sometimes unnecessary. And when you have an unnecessary course of antibiotics or a C-section, that affects the microbiome.
100%. Something you're hitting on this bigger theme of what's changed over the past decades and alarming trends. And you start off the book by the fact that more Americans, excuse me, today have peanut allergies than at any point in history. Why?
This is a uniquely American problem, and to some degree in the UK as well. Peanut allergies were rare before the modern era. In prior generations, it was extremely rare, and when it occurred, it was mild. Today, we have an epidemic. There's been a mass increase in peanut allergies and a new type of allergy, which is the ultra severe sensitive allergy. That is, kids can go into a life threatening anaphylactic allergic reaction just being close to a peanut without even consuming it or touching it. And this modern epidemic of the peanut allergy was by and large ignited by the medical establishment's arrogant and incorrect recommendation for all children 0 to 3 years of age to avoid peanuts altogether, and for moms who are lactating or pregnant to abstain from all peanut butter and peanut related products. That abstinence approach was intended to prevent downstream peanut allergies, but they got it perfectly backwards. It causes peanut allergies. The experts in the year 2000, about 24 years ago, forgot about a basic concept in immunology known as immune tolerance. Parents and grandparents had described this as the dirt theory for many years. That is, when you're exposed to an allergen early in infancy, in the first several months of life, the body learns to recognize it, and it doesn't become sensitive to it. It tolerates it. That's the idea of immune tolerance. And so the best practices now are recognized in the last several years to be the exact opposite of what we've been recommending as doctors. The best practices, and I interviewed the top allergist in the book Blind Spots, where he describes the importance of introducing a little bit of peanut butter when a kid is 5 months, 6 months, 7 months of age, as soon as the child can eat, not as the main staple of their diet, but as a little supplement, along with a little eggs he recommends, and um, milk sometimes, just a little bit to introduce it to the immune system. One pediatrician I talked to even recommended the kid being around cats and dogs. And these things can prevent allergies because of the concept of immune tolerance. And matter of fact, earlier this year, there's a big study, once again, affirming that the American Academy of Pediatrics for 15 to 17 years got this perfectly backwards. And you didn't hear an apology. So I think it's important for parents to know the truth when it comes to allergies in the immune system. To this day, we are one of the only countries with a massive peanut epidemic. You don't see it in Africa and many parts of the world that never adopted the peanut abstinence recommendation of medical experts.
Well, it also brings up the unfortunate fact that in our extreme diet culture, people embrace a certain way of eating, call it, I'm going to be carnivore, and they eliminate food groups altogether. Maybe not a good thing.
Yeah. So I think the immune tolerance concept would suggest that having a strict diet early in life may not be good for early exposures to all kinds of things that can be allergens later in life.
And for adults, I would assume that's the same thing. That's right. If you eliminate a food group for a number of years, you may be setting yourself up for a strong immune response.
Well, the immune system really learns to recognize allergens in the first couple years of life. So that is a unique window. And same thing with the microbiome, the garden of bacteria that line the gut. That really is formed in the first couple years. That's why it's critical not to give a child antibiotics when they really don't need it. It's altering the microbiome. There's an incredible study that came out of the Mayo Clinic just very recently, I describe in the book, and I talked to the researchers who did it. It was unbelievable this study did not get more attention. In my opinion, one of the biggest studies of the last 10 years. They took 14,000 kids at the Mayo Clinic, and they looked at kids who had received a course of antibiotics in the first few years versus kids who did not. Now, as you know, antibiotics can carpet bomb the microbiome and alter that garden of bacteria. And they found that children who took antibiotics in the first few years of life had a 20% higher rate of obesity. And by the way, farmers have noticed that in animals for a long time. That's why in agriculture and mass factory farming, they give antibiotics routinely to animals to make them fatter. Well, the head researcher here said, if it's true in animals, is it happening in children? Sure enough, the study suggested yes, and the mouse models as well. Here's the kicker. The kids who took antibiotics in the first couple of years of life had a 32% higher rate of attention deficit disorder and a 21% higher rate of learning disabilities. Now, as you know, some of the bacteria produce serotonin, and we know there's a connection to the brain and mental health with the gut. There was also a 90% higher rate of asthma and nearly a 300% higher rate of celiac. And the more courses of antibiotics a kid took in the first couple of years of life, when the microbiome is particularly in its formation mode, the higher the risk of each of those chronic diseases. And all those chronic diseases have been increasing in the modern era of the overuse of antibiotics and unnecessary C-sections and ultra-processed diets and perhaps seed oils.
So, something else, you mentioned ADHD, and there was actually something that just broke this morning on fluoride, which you mentioned in your book. Can we talk a moment about fluoride in drinking water? Because that's also been linked to lower IQ, and it's a little bit of controversy, but it's in the book.
Yeah, look, if we got as a medical establishment, and we don't want to create cynicism or hysteria, but as a medical establishment, when we use good science, we shine as a group of doctors. When we wing it and rule by opinion and issue edicts with incredible absolutism, when the reality is we don't know, the right answer is we don't know sometimes, then we have a terrible track record. And if we got all of these major things wrong in the last 20 years, the low-fat diet, saying opioids were not addictive, the peanut allergy recommendation, we'll talk about hormone replacement therapy. If we get all these things wrong in the last 20 years, what are we getting wrong today? And I think putting fluoride in drinking water may be one of those issues. It's in over 90% of the drinking water in the United States. It is in 3% of the drinking water in Europe and about a third of the drinking water in Canada. A new study in JAMA Pediatrics followed up on this theory that the fluoride may accumulate in a learning center in the brain, and found that the IQs of children were lower when exposed to fluoride. There's also another concern with fluoride, and that is if we're using it to kill bacteria in the mouth, and it is what we call bactericidal, that is, it can kill some bacteria, and reducing cavities from putting it in the drinking water, what is that fluoride doing when it goes down your gut? What is it doing to the bacteria in the microbiome? No one has thought about that. And we do know the microbiome is being altered in a modern era in ways we don't fully appreciate.
I'm going to zoom out for a second. One of the reasons why I was so excited to speak with you is you are extraordinarily credible and you are reasonable. And I'm with you. You don't want to cause unnecessary cynicism or hysteria. But at the same time, some of the words we've used to describe the medical establishment, arrogance, you talk about studies not receiving attention, you talk about the establishment's inability to be challenged, Keys, slick politician who convinced the entire medical establishment. And so I would not consider myself a conspiracy theorist whatsoever. I think I'm like a pretty balanced guy to some degree. Others may think differently. But when I get asked this question, when I see things on social media that are absurd from people who aren't credible, and then I see things on the other end from the Western establishment, which to me are just rooted in the past, I struggle. And this is what I do for a living. How does the average person navigate this without, again, like becoming hysterical, a cynic, a conspiracy theorist? How do we navigate?
Well, I think, first of all, the rank and file doctor in America tends to want to do the right thing and has the humility to say, I don't know when that's the right answer, even when the medical establishment doesn't have that humility. We saw that during COVID. Many times the right answer should have been, we don't know. You saw both extremes put things out there with such absolutism. And the reality is, we were evolving as the data came in. I meet doctors who are very nuanced. They understand the controversies in the field and they're willing to share that with their patients. They'll have that conversation. Others kind of don't like questions and you got to do this just because I'm the expert. And that's a flag. You want somebody that you can have a conversation with.
Jason Walkup here, founder and co-CEO of mindbodygreen and the host of the mindbodygreen podcast. Please subscribe. You'll never miss a show and you won't regret it. To me, the most powerful 3 words you want to hear out of a medical professional's mouth, whether it be on social media or in their office, I don't know.
Yeah. Yeah. And look, I'm training medical students at Johns Hopkins and residents, and I tell them what's going to make you a great doctor is not memorizing every molecule in the Krebs cycle. It's your humility.
So, okay, a couple more topics we want to touch on that you mentioned. The opioid crisis. You have a quote, and this really struck me. The size of the opioid crisis was downplayed as the size of the breast implant illness epidemic was overplayed. I never would have put those two in the same sentence, but here we are.
Yeah, this was an example of a massive distraction. There was a bandwagon effect, a groupthink by policymakers to suggest that breast implants were causing a breast implant syndrome that resulted in a chronic fatigue syndrome and general body silicosis that was poisoning women. Well, and there was a feeling that they were causing autoimmune diseases. Well, the media ran with this and they scared the crap out of women worldwide. There were 1 million women with breast implants, and half of them joined this class action lawsuit to suggest that they were having these side effects from general body problems. Turns out the studies caught up and there was no association. The lawsuit was thrown out. And in the middle of this giant kerfuffle, where the FDA stepped in to ban silicone breast implants for years, the same FDA approved OxyContin based on a shoddy 14-day follow-up study and approved it for chronic pain based on a 14-day study. And so it just shows how there are giant blind spots in modern medicine, and we've got to stick to the good science.
And another one, very topical right now. And I do think consensus has turned on this one, maybe in our space, which is a little bit more health forward, hormone replacement therapy.
Oh, big time. This is probably one of the biggest screw ups in modern medicine, and it's tragic. So, hormone replacement therapy for postmenopausal women, that is, starting estrogen or estrogen plus progesterone at the time of menopause or within 10 years of the onset of menopause, is amazing. Women live 3.5 years longer. The estrogen replaces your body's natural estrogen or estrogen progesterone hormones. The rate of heart attacks goes down by almost 50% because the estrogen produces a nitric oxide, and that helps keep the blood vessels dilated and soft. The rate of cognitive decline goes down by 50 to 60%. In one study, the risk of Alzheimer's goes down by 35%. And if a woman falls or is in a car accident, they're far less likely to break a bone. Their bones are much stronger. And so they have less hip fractures and other complications. And on top of all those long-term health benefits, it can alleviate most of the symptoms or many of the symptoms of menopause. There's probably never been a medical intervention that has improved the health outcomes of a population more than hormone replacement therapy in postmenopausal women, arguably with the exception of antibiotics. But tragically, women have been denied this therapy because of a dogma from an announcement 22 years ago by an NIH scientist claiming that it caused breast cancer, when in that study, the data never showed a statistically significant increase in the risk of breast cancer. One of the greatest misrepresentations of data in the modern era. And because the media ran with it, and because that scientist did not release his data at the time of the announcement, tragically, 80% of doctors today roughly still believe that it causes breast cancer and refuse to prescribe it. So 50 million women in the last 20 years have been denied this incredible health benefit.
Insane. And on the flip side, for us men, middle-aged men like myself, TRT. What are your thoughts on testosterone replacement therapy?
So hormone replacement therapy for women has been studied far more than testosterone replacement for men. But in the little research we have on testosterone replacement for men, there appear to be some parallels. Testosterone levels go down typically when a man's in their 50s or so. And there was a dogma that it causes that taking exogenous or prescribed testosterone causes prostate cancer. That's been debunked, just as the hormone replacement therapy in women causing breast cancer has been debunked, or at least I explain how that's not true in the book. Um, and so there are benefits, and doctors have described testosterone replacement for men helping with sleep and energy levels and help with their workouts and losing weight. And so there are candidates for testosterone replacement in men. It's just less well established. And you really want to do this with an endocrinologist or a doctor who understands the pluses and minuses. And sometimes you need to take other medications to prevent what we call feminization features of the body. So it's not something you should get at a gym or pill mill. It's something you should get with a good doctor.
So you mentioned pill mill. This wouldn't classify in the pill mill, but it is a pill. And something I was surprised to see in the book, Tylenol.
Yeah. So we have this reflex. The medical dogma, Jason, can take on a life of its own when it's based on nothing. There's no scientific support. Matter of fact, it could be counterproductive. And Tylenol or ibuprofen, either one for fevers as a reflex, has been something we in the medical establishment have been doing and teaching to moms worldwide for decades now. Oh, my kid had a fever. Well, I gave him a Tylenol. What else should I do? Well, we don't need to be giving Tylenol or ibuprofen, what we call these antipyretics, for fevers if a child is not uncomfortable. Matter of fact, what we may be doing is suppressing the body's natural way of trying to rid itself of the infection. And so studies have just come out, and I did describe these studies also, that taking Tylenol for a fever not only prolongs the illness because the body's not reaching those higher temperatures to try to fight the infection, but these medications alone may have some downsides to the liver and to a young developing mind. That's research out at Duke University. Most of the research I cite in the book, are from top research centers in the country, great scientists at the top of their field, but it's just not mainstream. It's not penetrated into those main inner circles of the medical establishment. But I felt compelled to share those because I think people need to know about it for their health.
So for Tylenol specifically, is that one where, fever gets in very dangerous zone for a kid, like 103, 102? Like, is it the dose problem where we just, I'm a little over and I just pop it like candy? Like, how do you think about when to distribute Tylenol and when to maybe lay off?
I would say that times to give Tylenol to a child or to anyone is if they are visibly uncomfortable, and the Tylenol can help alleviate some of that discomfort. There's also a concern of a seizure from a fever, what we call a febrile seizure. But in children, that febrile seizure is from the rate of increase of the temperature, not from the peak temperature. So when people already say, hey, the kid had a temperature of 102, well, giving Tylenol at that point is not going to prevent a febrile seizure, and febrile seizures are rare. So it would only be in very rare situations where I would recommend Tylenol, but I would say for parents, think of it in terms of this. If the kid is visibly uncomfortable from the fever, you don't want kids to suffer, and that's a reasonable time to intervene with Tylenol.
Another big one, and I think this one is ridiculous, but I'm of the minority. You're on board with this as well. Marijuana.
So people think marijuana today is the marijuana of hippies and that it's entirely safe. But marijuana today is roughly 20 times more potent And even though it may have lower health complications in adults, that may not be true for adolescents where their mind is still developing. The drug may have a different impact on young, healthy teenagers. And so some studies have found that among teenagers who use marijuana, the risk of a psychosis diagnosis later in life goes way up, as many as 25% of people who consume it. And there's also some other complications, depression and mood disorders, and there are cardiovascular downsides that's been established now. So the idea that it's totally safe is a medical dogma that really is not true to the actual data on what we're learning about marijuana. I'm not making a statement about the legalization or non legalization, simply that to suggest that it's entirely safe is not consistent with the real scientific literature.
100% agreed. And one thing I'll call out too, the brain develops in some people up to age 25. So even in your 20s, your brain is developing. And in my own N of one anecdotal experience with friends, unfortunately, I've seen friends like really suffer their mental health and we're never the same. And you don't want to roll the dice with your mental health. It's not like, your microbiome to some degree, okay, like let's reset it. Let's get some more plants, some fruits and vegetables, some whole foods. I can maybe reset my microbiome to some degree. It's hard to reset your mental health once you start to have it slip away.
That's right. And even the transient effects do alter somebody's judgment. They're impaired when they're driving or doing other things. So there are many considerations.
So there's so many of these in the book. I encourage everyone to pick it up. Fast forward to today, 2024. What are you most concerned about? What's a blind spot we don't know?
Well, I think we need to rebuild public trust in the medical profession. Unfortunately, some of the hubris of the medical establishment has resulted in people saying, we're just not going to have anything to do with the medical establishment. If you take childbirth, for example, we were doing it wrong for decades. In some places, the childbirth process is still a massive medicalization of ordinary life. But then you see people retaliate or rebel from that and then have an entirely medical-free childbirth, which has risks. If things are uncomplicated, it can be safe. But when things go wrong, that can add risk to the pregnancy and to the child. And so we see this pendulum swing back and forth. In the case of childbirth, we were doing crazy things in the medical profession, separating babies from their mothers the second the baby was born and keeping them in a separate room for 3 days. It was actually up to 10 days in the 1950s and 60s. Doctors, had to have the baby to poke and pry and give our infant formula to, and the parents couldn't see the baby. I remember when my little sister was born in the 1980s. And I asked mom and dad, I said, hey, when is our new sister coming home? And they said, well, the doctors haven't released her yet. Well, there's nothing wrong with her. This was the over medicalization of life. And I'm concerned right now that we still over intervene in so many aspects of medicine. In children, we are seeing now children on 3 and 4 medications, not because they're bad children or they're born genetically with a requirement for these medications, but because we've created these intense, lonely, and isolated environments, and they have depression. We've created a feeling of left out with social media and addiction to cell phones. These are iatrogenic problems. And when we take a step back, Jason, we've got to ask some big questions. We have got the most over-medicalized generation in the history of the world. Chronic diseases are going up. We're seeing toxins in the environment go unstudied. And maybe it's time to take a step back and ask different questions. Can we treat more diabetes with cooking classes instead of just throwing insulin at people? Can we treat high blood pressure by talking about the quality of one's sleep and the stress in their life? Can we talk about school lunch programs instead of just putting every kid on Ozempic? Can we talk about environmental exposures that cause cancer, not just the chemo to treat it? We need to get into food as medicine and general body inflammation at the NIH. We need good, robust studies on microplastics and toxins. These are not topics that have been mainstream in medicine But early research, as I show in the book Blind Spots, is telling us there's a major signal in the data that we should be looking at and we're not looking at. So this is the movement in medicine now to say we've got to take a fresh, new approach and start from scratch.
Amen. How can we get you to run the NIH? Is that in the cards?
There have been people who have brought up some of these important things in the past. And just like John Yudkin, the scientist who challenged Ansel Keys and said, no, it's sugar, it's not fat. They just did not get their, airtime they needed.
Oh, so something you mentioned earlier is kind of the archetype of the doctor who knows it all, and that's challenging to deal with. How do you suggest we navigate if it's just us? I think the easy way is, okay, sorry, I'm going to find another doctor. I think many of us are in the situation where it's the doctor for maybe a parent or a loved one, and you don't have that ability to necessarily walk away. You're stuck with this person. How do you suggest we become better advocates when we're dealing with a doctor, or maybe in a situation in a hospital with a doctor where you're kind of stuck there when you're facing, maybe an inability to see the bigger picture, if you will?
Well, nowadays, people are doing a lot of their own research, and you can do research from trusted physicians, from experts with good credentials who know their stuff. And in the past, we didn't do this. In the past, we had a very paternalistic approach to medicine. The medical establishment blocked home pregnancy tests because they felt women can't handle this information on their own. For decades, people could not get an HIV test result on their own. They had to come into the hospital to get the report only in a doctor's visit where they would explain it to you. And we saw a little bit of this controversy rear its head up when the idea of home COVID testing came up. Again, you saw people say, people can't handle this information. We can't have people testing themselves. And this threat of paternalism is being challenged now by a group of doctors, and I'm one of them, that are saying we can go directly to the public. And there are Substacks, there's podcasts, there's your work, Peter Attia, and I know you've had him on, a colleague that I used to work with at Hopkins who's doing great work, Vinay Prasad, Casey Means. There's a group of doctors and a new generation of young students and residents saying, we can talk in a way that the public can understand us and see our civil discourse and see where we're entirely united and where we have different opinions. And that's okay. It's okay to have different opinions.
Well, you also mentioned paternalism, and it's no secret that we've kind of ignored women. And you've got some great physicians, some great doctors: Stacy Sims, Vonda Wright, Gabrielle Lyon, Jamie Seaman. I could go on and on of saying, I'll quote Stacy Sims: "Women are not small men. We can't look at studies that were done exclusively on men and just decide that because it worked for a man, it's going to work for a woman."
One of the new areas of research is recognizing that we don't need to take out normal, healthy ovaries to prevent ovarian cancer, because the most common and lethal type of ovarian cancer comes from the fallopian tube, not from the ovary. The cells deposit on the ovary, but taking out normal, healthy ovaries in low-risk women does not prevent ovarian cancer. We've been targeting the wrong organ for decades. And now the new recommendation, at least at Johns Hopkins, is when a woman comes in and says, hey, I'd like my tubes tied, we say, we don't do that anymore. We recommend removing the fallopian tubes, leaving the ovaries in place to reduce your 1 in 78 chance of developing ovarian cancer. And when a woman who's finished having children and still under age 70 or so, we will, when they need, say, general surgery in their abdomen, that's elective. They need, let's say, their gallbladder removed. We are now offering to have the GYN surgeon come in during that operation and remove the fallopian tubes, sparing the ovaries, to reduce that 1 in 78 chance of ovarian cancer. So it's a new recommendation. It's a practice that's now gone standard of care in Canada and Germany and other parts of Europe. Many centers in the United States are starting to recognize that we can perhaps do this as a way to reduce the risk of the most common form of GYN cancer death in America. And so it's an interesting product. But anyway, I mentioned this example that I go into in more detail in the book. But I mentioned this because one doctor told me, a male doctor, he said, "I don't see what the big deal is. Why don't not just take out the ovaries?" And we're taking out millions of healthy ovaries for really no good reason, just the idea that we were preventing ovarian cancer. And I said, "Well, how about we just remove the testicles of men while we're at it once they're done having kids?" And he got quiet real quick, and he's like, "Okay, I see your point."
You pull out your sutures. Let's have at it. Oh, wow. So if you could wave your magic wand and get participation and funding for any study you could dream up, what would it be?
Well, I think right now we desperately need to understand the microbiome in more detail. We're seeing connections between the garden of bacteria that normally live in the gut and all these chronic diseases that are happening. And the preliminary research is really showing a correlation. There may be a correlation with Alzheimer's. That's the hypothesis of one laboratory that's looking at this at Rutgers right now. The gut microbiome is an organ system that's been in the blind spot of American medicine. Those millions of different bacteria that normally live in harmony are involved in digestion and making vitamins. They even make GLP-1, the active ingredient in Ozempic, in low doses naturally. They can regulate estrogen. It trains the immune system, and it makes serotonin, which connects it to mental health and the mind. So here's an organ system that is connected to everything that we don't really have a ton of information on. We can only recently study all these bacteria with what we call genetic sequencing. This is a giant area of research where we need to do more studies, because if you just look at the role of C-section, for example, it may be that C-sections, as a side note, alter the microbiome, because when a baby's in utero, the gut is sterile. There's no bacteria when you're pregnant with a child. There's no bacteria in their gut. The microbiome in a child's gut is seeded from bacteria when the child passes through the birth canal. And it's augmented by bacteria from touching skin and breast milk and grandparents kissing babies. And that microbiome forms in the first few days and years of life. Well, when you're born by a C-section, the baby does not have the bacteria from the vaginal canal seeding its microbiome. A baby is extracted from a sterile operative field. And what may seed that baby's microbiome are the bacteria that normally live in the hospital. And the microbiome looks different in a baby born by C-section. Again, C-sections save lives, but we've got to recognize what we're doing. And when we tell women, hey, there's no difference, you can have a baby by natural delivery or C-section, it doesn't matter, turns out that's dogma and it's not true. So we've got to study the impact. And one study that just came out of JAMA Surgery, one of our top journals, is that the rise in colon cancer we're seeing in young people, are you familiar with this new trend? That it was associated with individuals who were born by C-section. And so there's some signal in the data there we've got to pursue.
So here's my struggle. I agree the microbiome is the big unknown. It's the future. But something I struggle with here. So we mentioned CBD. Okay, number one killer. I got it. ApoB, LP little a. I go get my tests. I get a baseline. I could do it clearly. I can microbiome though with testing, at least in my experiences, a lot of those tests are all over the place. And I've talked to doctors about this. And they'll say, you know what, some of them are directionally accurate. I've also seen where a person takes a test on Tuesday and they get one result, and they take the same test again on Friday and it's different. And so, in my view, we all know this is the thing we should pay attention to, but until we can establish testing that is more accurate, it's hard to like establish a baseline and recommendations. What's your take on where we are with testing?
Gosh, I hear you, Jason. I'm with you. When you realize the importance of some of this stuff, we desperately want to have something that we can test for and go on and use to make recommendations. The field is just not mature enough right now. Now, I'm hoping that changes. New studies are coming out every month, and I go through all the latest ones in the book. But here are some general take homes. For good microbiome health, avoid unnecessary antibiotics. By the way, that's like 60% of antibiotics taken. Avoid unnecessary C-sections. Avoid ultra processed foods or limit them. Consider avoiding linoleic acid and the cheap seed oils. Consider reducing microplastics in one's environment. And maybe one wants to consider a defluoridation of their drinking water. I know doctors who have a device in their home that they put in to remove the fluoride from their drinking water when they've had young kids.
So one call out, I just want to, because someone's going to pick up on this. You said linoleic acid. So there's the seed oils, the cheap stuff we want to avoid. But what about nuts? Sunflower seeds, peanut butter. Does that fall into the bad linoleic acid category in your opinion?
Well, many things can. So, in terms of the oils, they can be healthy at low temperatures, but then not good for super high temperatures for cooking. For example, olive oil is one of those. You hear it's good, it's bad. Well, you don't want to be cooking at very high temperatures with olive oil, or at least there are better oils out there. Peanuts are a great source of protein. And as Peter Attia probably shared when he did your podcast, people are not getting enough protein in the diet. And thanks to Peter, we're seeing people move to higher protein foods. And nuts are a great source of protein. And that's why world food programs have focused on nuts. They're cheap. You can transport them. You don't need refrigeration. Tragically, the American medical establishment tried to block peanuts in world food programs, thinking it would, peanut exposure would cause peanut allergies. Of course, they had it totally backwards.
So just don't, we can keep the peanut butter, but just buy the peanut butter without the canola oil.
Yeah, and people should know some things may appear healthy, but when they're processed or they have tons of pesticides, it can change how we view them. For example, you think of a strawberry as being healthy. What if I told you an average strawberry is sprayed 12 times over with pesticides, right? So same thing with peanut butter. There are many types of peanut butter. So look at the number of ingredients on that peanut butter jar.
100% well said. Well, Marty, thank you so much for taking the time. I'll hold up the book again, Blind Spots. Can't recommend it enough. Our audience is going to love this one. Go buy it. In closing, where can people find you? Anything else you'd like to touch on before we go?
Great. No, thanks so much, Jason. Thanks for what you're doing. I think you're doing a lot to promote health. I'm on LinkedIn and all the social media platforms. Mostly I'm spending time in the hospital and doing our research, but I hope people enjoy the book. I loved writing it, so I hope people enjoy reading it as much as I enjoyed writing it.
Well, it is a winner. Go buy it, everyone. Marty, thank you so much.
Thanks, Jason.